Martel from the Overhead Athletic Institute. Today I'm working with one of my catchers, and I wanted to actually show his presentation just from a posture perspective to see how peculiar a case it is. He dealt with posture and still is dealing with to a certain extent. We've got him to the point where I show him from first to third without discomfort. We're still working on his mechanics to try and make sure that he distributes his load a little bit differently. But he's someone who's born with a lot of, you can see internal rotation, humeral internal rotation. And when he puts his arms to the outside, you can see he doesn't have much of a carrying angle. He has actually a varum presentation. So very rare for athletes. He has more of a varum presentation versus a valgus presentation. And so we've worked hard on some things that we normally don't work on. We're actually acquiring a little bit more external rotation. And you can see he doesn't pronate very well. So now put your hands up like this. And now roll your wrists over. Other way. So you can see on that right side he doesn't have a lot of pronation. So what ends up happening without pronation, it disallows him to access certain ranges of motion that are necessary for him to get his arm to throw a ball accurately and his wrist to throw a ball accurately to second. And so he's found a movement compensation that was very peculiar, but when we saw him throw originally, he had a very short abbreviated deceleration, which applied concentric load to the tricep and then a quick internal rotation without translation forward, which put a lot of eccentric load on the posterior part of his tricep. So he dealt with pain all across, right? It was all across, which was unique. But we got it a lot better. We're still in the process of doing it, but what I want you to do is lay on your belly. And so we've done some Graston, but with him we're doing a lot of functional massage and then some active release. But it's a very, very good thing to do. It's going to be something that I'm going to want him to continue to do on his own.
I don't want that to bother him. Okay. So I think those three, maybe hop on the bike afterwards.
So we'll spend a significant portion of time in therapy working on the tissue itself. It's actually changing its consistency. When I first palpated this, and I first used the Graston on it, you could feel a more fibrous presentation, and it's gotten a lot softer. You know, you do therapy for as many years as I have, you can feel, especially when you work with many shoulders and elbows as I have, it's very easy to palpate, and you can feel swelling, but you can also feel just a fibrous nature to the tissue that's irritated. So that's changed a lot. It's still not 100%.
Everything that's not that way. Okay. So whether it's doing these ones,
so I'm doing a lengthening procedure here.
Flexed a little bit, that's perfect.
And sometimes I'll work further up into the tricep. But today I'm just going to focus on the distal attachment. And so we'll go all the way from the radial head, all the way to the inside, medial part. Just keep working the tissue, and then I'm going to have you, can you raise the table up here? Let's see, yeah. We'll raise it up later. I want you to come towards me a little bit, and I want you to bend your elbow for me, and straighten, and bend and straighten. So we'll do a controlled active release. Once again, compressing the tissue. I'll use two hands here. Extend and flex. Extend and flex. Extend and flex, not his favorite. Extend and flex. Is that where you feel it? Mm-hmm. Yeah. Extend and flex. Extend. Right there, your most painful spot? Yep. Yeah. And go ahead and flex. What about right here? Not as much?
Mm-hmm. Oh, and
go ahead, flex. What about on the inside?
Mm-hmm.
Okay. So his was more of a lateral tricep pain. Extend, not something you see a lot of, but you will come across it occasionally. Extend and flex. Extend and flexed. Now I want you to keep your shoulder right there, go back to the center. Now what I want you to do is keep your arm right there. I want you to try and lift your wrist as high as you can to the sky. Don't rotate your arm up. Like this. So go ahead and do it. So he doesn't have a lot of absolute external rotation. You know, he's lifted some weights in his life, but it's not all just pecs trying to avoid it. So he's got some capsular restrictions. So go ahead and lay over on your back. So you check him in the scapular place. Okay, how much external rotation do you want? We'd like that to improve. So with him, I will do with distraction. Rotate the sky with your own, yep. And relax to the sky. And relax to the sky. And relax to the sky. And relax. Now pull your shoulder back in the socket. Try and rotate your arm to the floor backwards like that. And out to the sky again. And relax again. And relax. All right, test it again. A little different. So we're trying to acquire some range of motion so his arm's able to go through the positions that we needed to go to dissipate some of the load to the lateral tricep. So he's also got some pec tightness. So we've been showing him some stretches for that as well. Then horizontal adduction, but then you look at his horizontal adduction, his internal rotation, not too bad. So a lot of times we're dealing with the exact opposite. But, you know, it just goes to show when you look at an athlete, you have to evaluate how they move symmetrically from side to side. You have to look for other things that could possibly contribute to his inability to get his arm where it needs to be, and then identify what could be a contributing factor to his lack of, or to his pain. So now we're going to work on a roll, slide that way. So now I want you to supinate and relax, and he's stronger than I am, so more. Okay, so I'll put the elbow right here, supinate. And I do a contract, relax, and now supinate again. And relax, supinate again. And relax, now go the other way for me. Supinate again, other way, other way. And relax, rotate it out, come on, come on, come on, come on. And relax. So now go ahead and stand up again over there. And now let's see that again. Flip it over. Does it feel looser? Yeah. So you have to work in combination. You have to try and require as much. I mean, pronation is a very important part, especially at the end of the throw. If you can't pronate your arm, it makes it more difficult for you to be accurate, which makes you travel further back into behind the plane of the scapula. So just one of the things we see in therapy, a little bit rare for him, but you know that's why you have to look at it three-dimensionally and address as much as you can. Try and give them the ability to recover from their injuries best they can.